So here's the challenge: how you can design something with something urgent and that kind of protect them from the pandemic.
Something that is fast, that is quick, that can be tested really quickly, their lean production.
Good Practices, a podcast about municipal response to COVID-19 from Connective Cities.
Welcome to this episode of Good Practices from Connective Cities, the platform for promoting an international exchange of experiences among urban practitioners. My name is Daniela Marzavan. In this podcast, we get to know different practical examples from urban practitioners from all over the world who develop measures to tackle the challenges posed by this pandemic. Co-host by my side is Beate Stender.
Hello.
She is a journalist from Berlin, and together with the Connective Cities team, she has researched the stories. Beate, what is the good practice we talk about in this episode?
Well, in this episode, we get to know about a story from Iraq, from Salih Mahmod. Salih Mahmod is a young technician. He's 26 years old, and he lives in Mosul. And in Mosul, he's running a makerspace.
I'm Salih Mahmod from Iraq, from Mosul city, and I'm an electronic and communication engineer who start with a group of young people from the city, a makerspace starting from the university and launching outside the university. And now we have the Mosul Space organization that is working on developing the private sector through supporting entrepreneurs and running also co-working area and makerspace.
This sounds very interesting.
Yes, it is. He's a very young guy. He's 26 years old. He founded the makerspace in 2014 when he was 19, 20 years old. He was a young student. And Salih Mahmod told me in the interview that the lockdown in Iraq started in the end of February. And Salih saw a very big challenge coming to him, as he's explaining here.
The challenge started when the Ministry of Health started recording cases in Mosul, and even the people in Mosul feel afraid because they thought that it will not reach them, but now it's in the city. And at the same time, the Ministry of Health didn't have any preparation to fight the pandemic. So even they didn't have very basic tool to distribute it to their staff in hospitals. So here's the challenge: how you can design something or support the staff with something urgent and that kind of protect them from the pandemic.
So for Salih, the biggest challenge was that the Ministry of Health couldn't supply the local hospitals with medical supplies, which was a big problem because normally these supplies are delivered from China, but the transportation had stopped in the pandemic. And for some reasons, the local industry couldn't afford to produce these supplies so quickly. Salih and his team started to work on an answer to this challenge.
What I think it's really interesting about this good practice is that an actor from the innovation ecosystem was concerned about the situation in the healthcare system. So we are looking at how a makerspace, a community-based makerspace, can actually help support a health system in this pandemic. Let's have a look.
We started by communicating with some physicians in hospitals and asking them about their needs. So we realized this in the first 2 weeks, and we started to produce face shield for medical staff using 3D printers and some other basic available tools. And we used to send that to the medical staff, these prototypes, and then get a feedback from them, edit the designs and everything, and then send it back to them. And maybe there is another things that people in hospitals do, we don't know about their user experience a lot. So we use this way, and we produce a lot of face shield and deliver it to the hospitals.
And the interesting thing was when Salih was telling me this, I had this question in my head: how did they get the material when the transportation from China had stopped? I mean, even like there was no more material that they could get for this production. And I asked Salih, and he actually told me that they went to the streets to collect material.
Yeah, actually, we used to go to some like shop owners' houses to collect some material. We got to think about alternatives for some essential part, like instead of having some like well-cutted plastic, we go to some stationary part to bring a cover to be used instead of that plastic. And it was not easy because you need to do a lot of communication to double check if this part is available and how you can bring it to your office.
This sounds like a complex process to ensure not only the materials but also the good quality of materials. What else did they develop?
Well, they developed 2 more medical supplies. I think we hear what Salih is telling about that.
We worked also on another solution that can use to decrease the touch between the persons who want to go to the WC, the toilet, and the water machines. So that we used a lot of a proximity sensor to make everything on movement. We are working now also on developing a device that can generate oxygen from the natural air. And we used to change some factors, and now we reached the percentage of oxygen, reached 70% of the total output, and we are aiming to 90%. And we are still working on developing this device.
Okay, so they developed face shields, touchless flushing system, and a device that produces oxygen from the natural air. Did you find out what was the outreach of the medical supplies?
Yes, well, Salih told me that they delivered 3 hospitals and they delivered around 500 medical supplies.
But then we stopped to producing these shields because another trade bring the someone from China, and it's super cheap, and it's also good as a quality. So then people start using this, and there is no need to like just to produce again from this face shield.
Okay, Daniela, what do you think when you hear this? What is the important message that you're getting here?
Well, I hear Salih, and I hear how they developed this really quick response of developing user-centric design methods, something that is fast, that is quick, that can be tested really quickly, their lean production, but also how they basically took over the responsibility of a research and development department in a classical factory, and at the same time not competing with the mass production. So as soon as the mass production came in, they backed off and focused again on the developing and research.
Yes, I agree. And I think the interesting part is how quick they developed innovative products.
It's taken 3 months. The first month we are more focusing on the face shields because there was need for it. And then we start to brainstorm what's the other things that need to be focused on. And from the electronic devices, it's just to understand how is the system is working and bring the parts you need, and then the design it or programming the microcontrollers and everything. It's not taking a long because we used to develop different like projects for clients using the like same electronic parts. So it was not technically difficult for us, but like developing something that people can use it in hospitals and understanding the requirement from their side, the user journey from their side, it's very important.
When I'm listening to it, I think, wow, these are a bunch of guys that are not into the production of medical supplies. But
they are really good at handling electronic parts, and they're really good at digital production.
Yes, exactly. And I mean, 3 months is nothing in compared to how much time production needs here in our Western world, right?
Or in large companies where it takes 1 year maybe to develop an innovative product. So their readiness and their quick response came from the fact that they were used to this quick digital production, and they were really good at finding out what is the need, the immediate need of this crisis.
There was another thing that I was very interested in when I had the interview with Salih. I asked him if he get any support from someone. Did he get any support from the local government, for example?
Good question.
The system here is very difficult, the government system. So instead of working with institutes or like ministries, we prefer to work with some like small groups inside, let's say, hospitals, or like some very small entities inside the government, because it's easier to work with them. We used to depend on trusted people, and these trusted people like linked us with physicians inside hospitals or a department head, so that people really want to help people, and at the same time he understands what we are doing.
Okay, I understand. So Salih and his team mostly relied on the synergies within their own network for getting to the physicians and to the doctors to develop the right products. But if they didn't get any database for distribution from the government, how did they distribute their products?
Well, that's a good question. Salih told me that Mosul Space is pretty much into social media, and they even have their own social media specialist. And so, of course, they had a few campaigns via social media, via Facebook, for example. But the point here was that they work together with volunteers.
Here in COVID-19, there is many like voluntary group start working on supporting the government and the hospitals with a lot of things. There is people donating for this volunteer group, and this volunteer groups, they bought medical devices, they offer food for health staff, and they do a lot of things.
When I listen to this story, I'm really impressed on how small community-based actions really support the local ministries and the local governments. And I wonder what other municipalities with similar contexts can learn from the Mosul case.
The most important thing is to be prepared to work on with limited resources. So the things that I learned, even if you are a small organization, even if you have a limited resources, don't look for like big organization and tell yourself, when I will be like them, I will do something. They cannot do it with all the available resources that they have.
Yeah, and of course, for me, this is a super interesting conclusion. I mean, even if you have limited resources, even if you're a small organization, you can do it. You just have to go on. You just have to try it. You just have to be initiative, right?
Absolutely. I think this do-it-yourself spirit and the agile way of working helps really to combine the capabilities from universities, from local governments, and also from the private sector, from companies. And only through this small community-based approaches can you actually combine all these other capabilities that are out there. So probably the most interesting takeaway for other municipalities is to keep their innovation ecosystems ready, to invest in small maker spaces, to invest in small community-based technological spaces, to invest in local digital production for the case that the large supply chains collapse for whatever reasons, and to understand how volunteer networks can support and not be a competition for the traditional distribution systems, but actually in times of crisis build this bridge between the two systems and fill in the gaps. This was Good Practices, a podcast about municipal response to COVID-19 from Connective Cities. My name is Daniela Marzavan, and I was talking with the radio journalist Beate Stender about Salih Mahmod's good practice in Mosul. Producer Beate Stender, executive producer Daniela Marzavan. Thank you very much for listening. We hope you'll be back for our next episode. Stay safe and goodbye.
This podcast was brought to you by Connective Cities, the international community of practice for sustainable urban development, a joint venture between the German Agency for International Cooperation, the Association of German Cities, and Engagement Global Service Agency Communities in One World, commissioned by the German Federal Ministry for Economic Cooperation and Development.